Microbiologists, not seen perhaps? Well, only rarely anyway. A bit like bird watching, really. Not heard sometimes, unfortunately, and most of them lived in the laboratory. And another unfortunate thing, they were not really regarded as part of the quality team, which was most unfortunate. So the value and their potential not really recognised in those days. Slowly, however, the light dawned. I think most of you in this room are far too young to remember the Devonport incident, but that had a fairly dramatic effect upon GMP and microbiologists. 1971 also saw the first publication of the Orange Guide, so named because the cover was in fact orange. It ran to all of 22 pages. Just think about that. Can you tell me how many pages it runs to now? Far too many. It's almost obscene. Almost. But I just leave that thought with you because it's all about patient protection. Making pharmaceuticals, by and large, is not that difficult. Making sterile products, my background is sterile products manufacturer, and also liquid streams, ointments and solid dose. I find it harder to make solid dose products than make sterile products, believe you me. I'll leave that thought with you as well. Anyway, let's move on, because slowly, surely, the importance of pharmaceutical microbiology was recognised. Not just restricted to sterile products, however. It slowly covered to almost every dosage form you can think of. And what about Pharmig? Pharmig had become recognised and widely respected as a unique professional group, and that still holds true today, and I sincerely hope that will hold true in the next 25 years. It's unfettered by commercial considerations, which is very important, and I must say that it owes an awful lot, not only to the founder, Polly Hadjipiras, but all the former chairpersons and committee members. You've got a very, very active group indeed who look after the interests of Pharmig. And Pharmig has also been recognised as offering a valuable contribution to quality by Gerald Haddell. Gerald was here at the 20th anniversary, and he speaks very highly of Pharmig. Now, quickly, some final thoughts. Number one, the organisation and structure. What about it? Is it still fit for purpose? Is it facing all the future challenges? Secondly, what about the annual conference? Do we use it properly as a tool to plan the strategy and the future? Do we see the big picture about where Pharmig is actually going to go in the next few years? And does it really act as a platform for gathering all the ideas that you must have? Thirdly, what about the programme and the events, which are growing and are very varied? Is it going to be national, EU, or worldwide? And I know David knows my views about the finances. It's very, very important to keep a keen eye on whether these events are cost effective for farming. Thirdly, what about the industry itself? Are we really focusing on a changing scenario? I think we probably are. Do we identify new companies, biotech, high-tech, And of course the suppliers and the technology which is ever changing. And what about the authorities? I think that Pharmig needs to be more vociferous and interact more with the authorities as far as they're able to. So those are my thoughts on that. I'll leave you with one final thought, if I may. Please, please, Pharmig, never ever lose sight of your identity, your core beliefs, and the core values. That is incredibly important. I've seen other organisations lose away because they've gone away from their core values and beliefs. Anyway, thank you very much for listening and enjoy your conference.